The emergency rooms aren't overwhelmed with COVID patients now. It's just been a complete relief for the healthcare workers.
Encouraging news this week from OU's Chief COVID Officer, Dr. Dale Bratzler. He believes there are 5 things contributing to the drop in new cases. The first, the after-holiday surge in new cases. Also, a successful vaccine rollout. And we've made improvements on mitigating the virus, like hand washing and social distancing. The fourth, and this is important, Bratzler speculates that coronavirus has traits of seasonality, similar to other coronaviruses having higher case counts in the cooler months.
One of the remaining questions is there some natural history of the virus that suggests that it may become less active in the summer months or as we approach spring and summer? And do we have to worry about potential increase in activity in the fall and winter again next year?
And finally, a possible herd immunity.
Did some populations in Oklahoma achieve herd immunity? And I'm going to argue that in some of those younger populations, the people who were fairly social and mobile in Oklahoma that were spreading, had the highest rates of infection, were spreading the virus from person to person. Did they see, we were seeing more than 4,000 cases a day in Oklahoma. Did some of those populations of people actually achieve herd immunity? And so they're not spreading it nearly as rapidly as they were before.
So let's show you this. Statistically, how this drop has affected us. So on January 12th, Oklahoma was seeing 103 new COVID cases per 100,000 population per day, ranking us 3rd in the nation with the number of total new cases. Get this, as of February 25th, Oklahoma now ranking 21st in the nation. Dr. Bratzler also touches on vaccine alarmism. For those who may say, well, if I get vaccinated and I still have to return to wearing a mask and social distancing, why even get a vaccine?
There are 2 things that the vaccines definitely change. One is your chance of going into the hospital or dying from COVID-19 dropped dramatically. So that's the biggest benefit. But the second one is if you're working at the station and you're exposed to somebody that has COVID-19, but you've had both doses of the vaccine, we don't quarantine you anymore. That's a new change in CDC. And so that's tremendously helped the workforce.
Bottom line,
the best way to dramatically protect yourself is to get the vaccine.
Dr. Bratzler says COVID-19 has not been fully eliminated yet, so we need to remain vigilant and not let our foot off the gas. Christine Stanwood, KOCO 5 News.